Hey everyone, and welcome to Wellness. Today, we're talking about a serious health concern that affects millions of people worldwide: high blood pressure. Did you know that nearly half of American adults and 1 billion people globally have high blood pressure? That's a staggering number. But here's the good news. Even without medication, you can take control of your blood pressure with natural lifestyle changes. 9 natural ways to lower blood pressure. 1. Walk and exercise regularly. Exercise is one of the best things you can do to lower high blood pressure. Regular exercise helps make your heart stronger and more efficient at pumping blood, which lowers the pressure in your arteries. In fact, getting 150 minutes per week of moderate exercise, such as walking, or 75 minutes per week of vigorous exercise, such as running, can help lower blood pressure and improve heart health. Additionally, some research suggests that doing more exercise than this reduces your blood pressure even further. 2. Reduce your sodium intake. Salt intake is high around the world. This is largely due to increased consumption of processed and prepared foods. Many studies have linked high salt intake with high blood pressure and heart events, including stroke. However, other research indicates that the relationship between sodium and high blood pressure is less clear. One reason for this may be genetic differences in how people process sodium. About half of people with high blood pressure and a quarter of people with typical levels seem to have a sensitivity to salt. If you already have high blood pressure, it's worth cutting back your sodium intake to see whether it makes a difference. Swap processed foods for fresh ingredients and try seasoning with herbs and spices rather than salt. 3. Eat more potassium-rich foods. Potassium is an important mineral that helps your body get rid of sodium and eases pressure on your blood vessels. Modern diets have increased most people's sodium intake while decreasing potassium intake. To get a better balance of potassium and sodium in your diet, focus on eating fewer processed foods and more fresh, whole foods. Foods that are particularly high in potassium include vegetables, especially leafy greens, tomatoes, potatoes, and sweet potatoes. Fruit, including melons, bananas, avocados, oranges, and apricots. Dairy, such as milk and yogurt, tuna and salmon, nuts and seeds. 4. Cut back on caffeine. If you've ever downed a cup of coffee before you've had your blood pressure taken, you'll know that caffeine causes an instant blood pressure boost. However, there's not much evidence to suggest that drinking caffeine regularly can cause a lasting increase. In fact, people who drink caffeinated coffee or tea tend to have a lower risk of heart disease, including high blood pressure, than those who do not drink it still. If you suspect you're sensitive to the effects of caffeine, consider cutting back to see whether it lowers your blood pressure. Caffeine can cause a short-term spike in blood pressure. However, for many people, it does not cause a lasting increase. 5. Eat dark chocolate or cocoa. While eating massive amounts of dark chocolate probably won't help your heart, small amounts may. That's because dark chocolate and cocoa powder are rich in flavonoids, which are plant compounds that cause blood vessels to dilate. A 2017 review of studies found that flavonoid-rich cocoa may reduce short-term blood pressure levels in healthy adults. For the strongest effects, use non-alkalized cocoa powder, which is especially high in flavonoids and has no added sugars. 6. Try to lose weight, if necessary. In people who are overweight, losing weight can make a big difference to heart health. According to a 2016 study, losing 5% of your body weight could significantly lower high blood pressure. The effect is even greater when weight loss is paired with exercise. Losing weight can help your blood vessels do a better job of expanding and contracting, making it easier for the left ventricle of your heart to pump blood. 7. If you smoke, consider quitting. Among the many reasons to quit smoking is that the habit is a strong risk factor for heart disease. Every puff of cigarette smoke causes a slight, temporary increase in blood pressure. The chemicals in tobacco are also known to damage blood vessels. However, studies haven't found a conclusive link between smoking and high blood pressure. This could be because people who smoke regularly develop a tolerance over time. Still, since both smoking and high blood pressure raise the risk of heart disease, quitting smoking can help lessen that risk. Hit that like button, show your support, and stay notified about future informative videos on this channel.